part two. Dr. Micah Sadigh, you're very familiar with him. He came to Canada twice, and he's presented to us on the webinars a number of times. A psychodynamic exploration of the challenging patient, treatment guidelines and precautions. Dr. Sadigh, welcome back to Canada. It's all yours.
Thank you, Dr. Rawson. It's a pleasure to be back, and hello to everyone. Good to see you. It's lovely to see your faces there. I'm happy to be back in Canada via a very fast-moving virtual airplane, and I'm glad I just arrived. I just have a request. If at any point you can't hear me clearly, would you please let me know somehow, maybe through the chat, Bianca or Dr. Rawson can give me a hint, but I'll try to stay close to the screen.
You're doing fine, Micah. It's
great.
Loud and clear.
Thank you so much. That's very important. This is, as Dr. Rawson mentioned, this is part two of our exploration of the psychodynamic of challenging patients. I'd like to do a very quick review of what we covered in the previous lecture, and then move to two other personality disorders. I'd like to start by reminding all of us, of the inscription over the entrance to the Temple of Apollo in Delphi, which is Genothi Theaton, which means know yourself, basically, know thyself. Also in Latin, noscete ipsum. These lectures are about learning about patients, their psychodynamics, particularly those who may be presenting with very challenging issues that may frustrate you or challenge you or deplete you of your resources at times. And it's important for you to be aware of those personal responses, how you respond to these challenging situations. So I hope, in addition to learning about these personality disorders, you're also learning about your response to these disorders, which I think is extremely important. That they could alert you, at times warn you about what's happening, what's going on, so that you do not deplete yourself or burn yourself out. So, know yourself. So it's always a great message. If you recall, last time we said the reason we want to study personality disorders, anyone who's doing clinical work, engaging in clinical work, should have some awareness of personality disorders. The first and foremost is it gives you a different language of communicating with your patients. So it improves communication without a question, and I will show you many examples of that tonight. But I think one of the even more important aspects of understanding personality disorders is for us to have better empathy, empathos, to see the world through their pain, through their eyes instead of our eyes. You shouldn't feel this way. It's a statement oftentimes made by somebody who doesn't see the other person's world, their view of the world, through their eyes. So increasing empathy is by itself a profound healing tool. Oftentimes, you may come across situations where making the right diagnosis seems to be very challenging. You have all kinds of information, but you can't put them together to make sense out of things. There are statements made by patients or that are just, they don't make sense, or you're waiting for your patient to give you some feedback or give you some clues, and they're unwilling or unable to give you that kind of information. Having an understanding of personality disorders will help you facilitate the diagnostic process. And when we talk about the avoidant personality disorder, I will give you some very robust examples of what I'm talking about here. Understanding personality disorders helps you not to use your energy in the wrong direction, and to keep the treatment process as focused as possible. There are one personality disorder that I mentioned the last time, that if you're not aware of the dynamics of what's going on, you may spend hours with a patient. A ton of information written down on a piece of paper, but at the end of the session, you're saying, why did I see this patient? Or how come I can't put all this information together? That would be the histrionic personality disorders, in which you're going to go in all sorts of direction and away from the actual presenting problem. And the last one, which I think is a very serious one, and I hope you're mindful of this, is that exposure to personality disorders can, in time, burn you out. And burnout is a very real phenomenon. We should do a series of lectures on this topic. It's absolutely very real, and you wonderful doctors, after years of education and experience, burn out, and suddenly they don't want to have anything to do with their discipline, nothing to do with it whatsoever. And that's the reality of burnout. If you recall, last time we said that according to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, 5th edition, the personality disorders can be placed under 3 clusters. Cluster A, these are individuals who have a very eccentric presentation. Cluster B, patients with very dramatic presentation. And cluster C, these are highly anxious individuals, which is really the focus of these 2 lectures. Last time we covered dependent personality disorder. Tonight I'm going to do my best to cover avoidant and obsessive-compulsive personality disorders. And you see the kind of one word capturing what those are: hypersensitivity, particularly when it comes to being criticized, submissiveness, and circumstantiality. These clusters, in one word, disconnected, just they seem to be in their own world and disconnected from this reality. Everything is about me would be cluster B, and cluster C would be I'm expecting something bad to happen. So their coping mechanisms are based on anticipating and expecting something bad that's going to happen. So they've learned ways of coping with a reality in which there are lots of uncertainties, and that is through the experience of anxiety, and how they work through that anxiety is really what we're talking about. We did not talk about this last time when we met, but I talked about it 2 years ago when I was with you physically in Canada. This is based on a paper and later chapter that I published a few years ago. And it was really, my goal was to humanize what we call personality disorders. And you don't need to memorize the formula, but the essence of the formula is this: that all of us, every single one of us, has certain personality tendencies. Either we become anxious, or we withdraw, or we become very possessive. We become sensitive about relationship, etc. So those tendencies by themselves do not cause distress. They may be in the background, and we may not be even aware of them. However, if you add stressors, introduce a variety of stressors, and I just want you to know, if there was a large S, if you could put a large S, largest stressor ever would be pain. So be mindful of pain. Pain is a powerful stressor. And as time goes on and you have those stressors adding up, and then your coping resources are depleted. So that's CRs, coping resources. When coping resources are depleted, those personality tendencies become manifest with force. And initially, we tend to find ways of coping with these tendencies. As things are coming up, we may become more rigid, we may become more emotional, we may become more isolated. Gradually, we are compensating, we're giving things up. But at one point, it's really the definition of a personality disorder, our lives become so restrictive, so rigid, so inflexible that we can't cope properly, that we cause a great deal of distress in people with whom we interact on a regular basis. And ultimately, we're going to contribute to a whole host of pathologies, from addictions to damaging our relationships, or desiring, being attracted to relationships that are ultimately destructive. So this was a way of saying all of us have certain tendencies, and it's important as we go through these lectures for you not to diagnose yourself, but to say, do I have these tendencies? Am I, do I tend to become hypersensitive when it comes to certain situations, under certain circumstances, etc. And sometimes when we see certain things in our patients, and we have that awareness of ourselves, that actually is very helpful, because they may be pushing buttons and manipulating you unconsciously in ways that could be very destructive, unless you recognize, whoa, here's someone that's moving in a direction that is not comfortable, or that's where my vulnerabilities lie. Helpful to understand these things. Just a reminder that the tendencies or proclivities we see in personality disorders are not conscious tendencies. These are far away from conscious awareness. In other words, your patients are not trying to do these things to you. They are unaware of them, but they are manipulating you, or making you feel doubt yourself or your skills, or constantly criticizing you, or disappearing and making you wonder about your gifts and capabilities and your training, etc. So, however, these tendencies are very real, and it's extremely important to recognize. If I had a group of clinicians from different fields, dentistry, medicine, wherever in different fields, and I were limited to one personality disorder, so you're not allowed to talk about anything else but a single personality disorder, I would choose the dependent personality disorder, which I covered at our first meeting, because that has so many physical and physiological manifestations. What you will see tonight, these two also have a lot of physical and physiological manifestations. Someone last time asked a very important question when we talk about dependent personality disorder. In sleep medicine, what types of symptoms would you see in these patients? These three will manifest themselves in terms of sleep onset issues, sleep maintenance issues, and also sleep quality issues, because the driving force, what's behind these three, dependent, avoidant, and obsessive compulsive personality disorder, the driving force is anxiety, anticipating and expecting something bad to happen. So the avoidant personality, I think it is unbelievably sad, and what a terrible mistake to refer to these individuals who fall under this category as people who are antisocial. They are not antisocial. When people say antisocial, means somebody who doesn't want to hang around and be with others and socialize. That's what it's, you don't want to socialize. That's what we should say. Antisocial means somebody who goes against moral guidelines and rules, and he or she is the center of everything, and abuses others in a very vicious and destructive way. That's not who these people are. These are people who avoid social gatherings and social interactions, primarily because they are extremely sensitive, hypersensitive to rejection. They think that in every relationship, every single relationship that they're exposed to, they're going to be criticized. And how reality-based is this inclination? It is not. There's just something inside of them says that that I'm meeting with you, I'm meeting with my doctor for the person, they're going to find something wrong with me. They're going to say something negative. They're going to put me down. So that hypersensitivity actually by itself prevents them from getting close to others. So if they have to come in for pain and for some sort of dysfunction, for sleep-related disorder, that takes a lot of energy out of them to actually be exposed to others. So they try to avoid people. If they could live on an island all by themselves without jaw pain or sleep issues, etc., they would live in that island. In a very sad way, because as you will see, please remember this, they are so starved for affection. Deep down, these people want to interact with you. They really want to be liked by you. But there's this fear that you're going to be rejected. They come up with some strange ways of protecting themselves against this fear of rejection. Actually, these methods, these unorthodox methods, fail, and in fact, they backfire in a sense. And one thing that I'd like you to keep in mind is, and I'll talk more about it, is that they dress in a way that may make them appear disheveled, or their grooming is not proper, or they seem disheveled, basically. And at some level, their hope is that you won't look at them because they look like a mess physically, the way they're dressing. So you're not going to look at them. You look at someone who's dressed beautifully and you can compliment. You're not going to compliment them. This way, they're not going to say to you, "Oh, I like your scarf," or "I love the way you have your hair today." It's not going to happen. But actually, the way it backfires is that you look at them and say, "What's wrong with this person?" So in a way, you do reject them. So it's a very unfortunate thing. So, in time, they need to be made aware of that in very gentle and subtle ways. After you go through a series of tests, that's the best way I can describe it, they will begin to feel closer to you. So, and they get closer and they will provide you with a ton of information. They're incredibly observant and they can give you really helpful hints when they feel that you're not going to reject them. The first time that I actually put together a series of lectures for physicians here in this area was when I was approached. I gave a general lecture to a group of physicians, but I was approached by a physician who, very learned person, very skillful person, who wanted to know why he kept getting into trouble with some patients. And I really felt bad for him, so I shadowed him a couple hours actually. And those few hours, he happened to have a couple of chronic pain patients who had avoidant tendencies, and he damaged them. He unconsciously damaged them in the way he spoke with them. He thought he was being a coach and energizing them, and it was terrible to watch that actually happen. So after like the third or fourth session, I said, "Sit down, we need to talk," because of the way he was speaking to them, so and communicating with them. And then after a while, all these personalities, I had created a cheat sheet for him. So his nurse, one of his nurses told me that he would see a patient and walk out of the room and look at those pages that I'd made for him, and he would go back in, and things started working out. I think this needs to be a part of clinical training. You need to understand how different people respond to different stressors. Pain being a huge one. And just if you're happening to have people with avoidant tendencies, they are watching you, anticipating that you're going to say something like, well, I see you didn't wear your appliance. Or I see you've been chewing on this the wrong way. Or you didn't show up for your last appointment. That sounds very caring and very professional. To them, it's, I'm not good. You're throwing me out, so they're going to disappear. Please note, this is extremely important to keep this in mind. People with the avoidant personality disorder, they are starved for affection. They want you to like them. This is very unlike the personality disorders that presents itself as though the person is detached or disconnected, schizoid personality disorder. People in that category, they don't care if you criticize them or not. They're disconnected. Emotionally, they're disconnected. Very unlikely you will upset them because they have developed these very strong elaborate defenses against it. It's a whole different reality to them. And it's really sad to see somebody developing those kinds of defenses. Why are those defenses there? For them to survive. So I appreciate these defenses more than I can express in words. There's something ingenious about them. But in the long run, they also do a lot of damages because they disconnect us and prevent us from talking to each other. So down the road, when we talk about schizoid personality, I will tell you how amazing their inner world actually is. It's just incredible how they cope. They have low self-esteem, which means they do not, deep down, they do not like themselves. They have very little to say about themselves that is positive. In fact, when you get to know them, they will be staring at the wall and they will they will give almost little messages that I'm dumb. Oh, of course I would have done that the wrong way, etc. So there'll be opportunities to help them move away from those tendencies. People with the avoidant personality disorder have a very active fantasy life. That's when you see them staring elsewhere, and they're very observant, right? They're listening to you very carefully when you think they're not listening to you. They do have a fantasy life in where they're loved and they're taken good care of. Out here, nobody's going to take care of me. So in there, I'm safe. So lack of support. So please write that down in your notes. That should be one of your questions. And somehow you need to ask. Simply put, who is there for you? Who's there for you? You know, you're going through a lot. You're not sleeping well at night. You wake up with all this tenderness and pain, and we tried this instrument and that one, and it hasn't worked. Who's there for you? Who's supporting you? And with the avoidant personality, you're very likely to hear, after a long pause, my cat, my bird, and they may laugh about it. And then they're watching you to see if you laugh. Versus, oh, okay, well, cats are wonderful. They offer you a lot of company. Kind of see the world through their eyes. Don't need to say this out loud, but cats and dogs, they do not criticize us. So that's why they're so safe. All right, general features. Once you have established that this is the types of tendencies this person presents with, if you have to give them some sort of a suggestion, frame it in a way that does not appear like rejection or criticism. Note that you do not need to criticize them. They will criticize themselves. One way of that will help you to actually recognize that a patient may have this type of personality disorder is that they arrive late. They arrive the last minute. It's an appointment at 4 o'clock. They will arrive at either 4 o'clock or 4:01 or 4:02, so that they don't have to sit in the waiting room and socialize. So you see this also in people at meetings, and they show up. The meeting starts and they arrive. In the back of the church, back of the temple, boom, they show up last minute. So I don't have to socialize. And they'll come up with excuses so that they don't have to mingle. So fantasy world, they seem distracted, by the way, and I'll talk about this. That's what that can drive you crazy at times. Like, are you listening to me? They are listening to you. They're very, very attentive, actually. But they don't want to make eye contact with you. I'll show you. They could develop agoraphobia, fear of open spaces. Again, being around people who are criticized. If they go to let's say to supermarket, if ours is Wegmans, Vices here. I don't know what the analog is in Canada. They will show up late at night or when there are very few people around, so that people are not watching, interacting with them. Just saying hello to them sometimes creates anxiety. So agoraphobia is a potential manifestation of some of these personality tendencies. Once you recognize these types of tendencies, doctors, it's very important that if you have a crowded, maybe not these days because of the pandemic, but if you have a crowded waiting room, put them in another room, or put them somewhere where they can be like with 2 or 3 people versus 10 people. That can be very overwhelming, and they may stop coming to see you because of you have a crowded waiting room. Their anxieties converted into somatic symptoms, and this is what they use. And this is not malingering. This is very real. They use somatic symptoms not to go to work or to work at home or work at night. I can't come during the day. I have this bad cold. I have this condition. My back hurts, etc., etc. So they come at night when there's nobody around. This was actually a incredible case in the hallways outside my office, where we had this incredibly talented administrative assistant who had such strong avoidant tendency. Such every time they were going to fire her, she would somehow survive those situations. She was incredibly talented, but she had a hard time being around people. So she would get sick from this, that, back pain, etc., etc. But she would come and work at night. At night, she was fine. So somatic symptoms is a way of avoiding interacting with others. So Jane is a 51-year-old woman, arrives late for appointments. So this is, we're approaching some of the, kind of integrating some of the things we learned earlier. She appears disheveled, hoping that you will not look at her and you will not compliment her. But meanwhile, you're kind of turned off perhaps by she's dressing like this. She has jaw pain. It's very common. Bruxism is a common symptom you see with people who internalize things, will have anxiety, but they can't express it, but they internalize it. Poor sleeper. Tomorrow I have to go to work. Tomorrow I have to go to this place, that place. So a great deal of anxiety. She lives alone. Mom passed away. Mom was the only person that she lived with. Mom understood her in some ways. Please note they tend to have symptoms that could potentially take them to the emergency room, chest pain, etc., anxiety related. Her best friends, she may laugh at this, or she may be embarrassed to tell you that her best friends are her animals. But again, remember that they don't criticize you. This is where know thyself is important. you're trying to get their attention and they're looking the other way. And you raise your voice or you make noise, and at one point you may actually say, "Are you paying attention to me, ma'am?" or et cetera, et cetera. So you seem distracted, because if I were to look at you, then you will look at me, then you will find something wrong with me. You see the dynamics of what's going on. So in time, when they look at you and you're looking at them and you're still gentle and you're still kind, they look at you a bit longer and longer. You work with people, I said this the last time, and in dental medicine, you're so close to their unconscious. You're triggering a lot of these mechanisms, and knowing some simple ways of, without saying it out loud, saying to them, I'm here to take care of you. I'm not here to criticize you. So sometimes not forcing them to look at you. You never want to say, could you look at me? If you were to turn your head, just get close enough to them so that you're close to the level where they may make eye contact, and they turn and look at you. So you don't have to turn a lot. So, they will smile at you if you do that. It's like, if you don't want to look at me, that's fine. But my head is very, very close, just tilted in the direction of your eyes. And they'll turn again, they will smile at you. Oh, that says, am I good? Am I good? One of the gifts that you have, honest to God, forgive me, I don't think you know about this one, is the moment you never touch something that's bad. You don't go and say, oh, that thing is bad, I'm going to touch it. You don't. So touch has an affirming quality about it. So when you touch someone, you're saying there's something good about you. So can I ask you, practice this tomorrow? Please, would you please? After years of clinical work here, getting some, just test this on yourself. As you're going to touch your patient, as you're approaching, just say in your mind, I'm touching something that is good, versus here like this messed up teeth or swollen gum. No. Ooh, this is a something nice. This is a good mouth. This is a good body. Think something positive as you touch. The feel, the way you touch their mouth, their face, their neck, etc., will change, and they will sense that. They will sense that you're not touching something mechanical, but something that has a something beautiful about it. My orthodontist, the late Dr. Arnie Cook, you would go there and it would tighten you, all these wires and everything, and you were in pain or discomfort. He automatically, and it was not like he was faking it, but he would come and touch your face when his assistants were done with these wires, and he would say, you look beautiful. Even if you didn't believe him, there was something beautiful about that message. You don't need to say that right away. You need to say that human beings are full of wonder. There's something incredible about this structure that chews and bites and moves around and does all these incredible things. The mouth is unbelievable. Remember, that's the dependent personality. That's the openness to dependency, actually, is through the mouth. Be reassuring. This is going to work. Hang in there. We'll be fine. We'll work together. Please use we, very much like I asked you to use that term with dependent personality. Try to be consistent. We are human beings. Sometimes we're not so consistent. But if you are touching them with gentleness, tenderness, focusing on them, trying to make eye contact, try to make that a common thing that you do. So this physician that I honestly, if you were here, he would tell you that all these troubles he used to get in with patients and administrators, etc. It's all because on patient's chart he would have these codes like watch this, or do this, do more of this, don't say this, etc. These lectures hopefully will help you in that direction. Please note that the fifth item on why are we studying this was to prevent burnout. I don't want you to burn And if you ever burn out, there are ways of reversing it. Knowing what's going on and the fact that they're not looking at you, it's not that they're criticizing you, actually it's the opposite. They're afraid that you will be criticizing you. So if you're kind to them and you're talking about we, and all of a sudden you say you, didn't wear your appliance, etc., etc., they may set things up so that you're testing. I forgot to wear my appliance. You know, Jane, I need to remind myself too. I put a note on the mirror sometimes to wear my appliance. And these things happen. Oh, very good. So we are resonating with each other. Try to speak their language. Please do not expose them to too much social stimulation. If you have like a presentation that patients sometimes are attending, or again, if you have a crowded, post-COVID crowded waiting room, that's not a place to keep them. Focus on their positive qualities. They are incredibly observant. So remember one word, they're incredibly observant. They will tell you, did you know that your office manager is pregnant? Oh, I had no idea. Well, they're very observant. They pick up, they listen to things that people are saying. Please do not criticize them. Constructive criticism is more like, let's talk about this. How can we make this work better? Tell me what didn't work about this versus you didn't wear this or you didn't wear this properly. Oh, you can wear it that way, but that's not the best way to wear it. Let's try it this way. Try to get their attention again without tilting your head. That's please note they're starved for affection. They're beautiful human beings. They're just something very incredibly tender about them. If you like animals, talk about animals. Start by talking about your cat, dog, etc. If you don't like animals, don't talk about animals. So, transitional objects are important. Please remember all three of these personality disorders, not just something that your secretary writes, but something that you write on your card, and you say, Sally, please wear your appliance, okay? Puts a smiley next to it. See you next week. And they will hold on to that as though it's something sacred. And it is sacred. It's a connection, relationship between the two. Do you feel frustrated or confused by some patients who seem to be tuning you out? What's wrong with this patient? I feel like I'm talking to myself. Seem to be ignoring you. They're bothered by the way they dress, or their hair, the way it presents itself. You feel tested by them. They're asking you. Last time you kind of looking up. Last time you said I should wear it only at night. Today you said every time you take a nap. Yeah, God, are you picking on you? No, it's. They want you to be consistent. Consistency means predictability, means lower anxiety. And I would be very quick to highlight, hey, sometimes I forget, and I laugh at myself. Here's a patient that suddenly disappears, they're gone. Ask yourself, did that make me feel relieved or am I puzzled? We were making progress. What happened? You may be talking about a person with avoidant personality disorder. I hope you have taken notes. And if it's okay with you, David, I have time to go into another, right? We don't want to start the Q&A at this point, do we?
No, another 15 minutes. Is that good?
Yeah, I'll do my best to go through this for 15 minutes. Yes, please. Thank you.
Okay.
So, obsessive compulsive personality. First thing, I have it in one of the outlines that's coming up, one of the bullets. But please note, this is not obsessive compulsive disorder. They really don't have much in common. Obsessive compulsive disorder is a set of symptoms, set of compulsions and obsessions. And that's treatable. We can medicate it. We can treat it with different techniques. This is a personality disorder. This is the way a person deals with life. They may have obsessions and compulsions. They often do, but it's not obsessive compulsive disorder. It's a personality presentation. This is the this is their demon. If you would say the demon is they are preoccupied with perfectionism. They have to be perfect. You don't have to be perfect. They project that onto you, but I have to be perfect. And deep down, they know I cannot be perfect. So they have to create a rigid, extremely rigid world and reality in which the world is so predictable that the chances for making a mistake are reduced and curbed to a large extent. So they're not going to make the wrong decisions. So ask them to make complex decisions and they will fall apart. They want everything to have a tight structure of the body. They have a very restrictive way of expressing emotions, if any. They walk in, you don't feel tender or anyone walking in and talking to you in a tender and comforting, caring manner. They seem much more mechanical and disconnected from their emotions. Often very intelligent and good at verbalizing their concern. But forget about someone who is socially gracious. Very unlikely to. It's very nice to meet you. Yes. You know, it's like thank you or thank you, nice to meet you. We're not going to hear that. Those social pleasantries, they don't exist. You look wonderful today. Yes. Speaking to what? Why would somebody be robotic toward me? It's to control the environment. That's what they're trying to do. On and off type of a decisions, yes, no. It's a lot easier than let's consider the following options. That will overwhelm them. So they try to live in a world that things are black and white. You're either black or they're white, and I want to live in a world where these are two options, black and white. That's the two colors that I'm most comfortable with. That's how they view their reality. So please do not confuse it with obsessive compulsive personality. From a psychoanalytic perspective, they're fixated in the anal stage. Anal stage is the stage where if somebody's fixated, they become very rigid, very controlling, stingy, inflexible. Everything has to be predictable. Everything has to be in its place in a certain way. And as you can see, there's certain professions that will be very attractive to these people. Where, like, I was giving a lecture to in one of my classes, was talking about very briefly about this disorder, and somebody said, "Oh, that's my mom. That's my mom, and she's an accountant. Everything is a number. There's no numbers are predictable. You don't have to read into them. Not for an accountant. It adds up to a certain number." They don't want you to control their lives, and they may appear very stubborn. One way they manipulate you is like at one point you notice you're doing things that they want you to do, even if it's something that you do not like to do. At one point it's like, why am I doing it this way? Because they're changing into their way of perceiving reality. But that could be quite frustrating. You say, why am I doing it this way? Now I'm saying things in a certain way. I'm holding an instrument in a certain way, etc. You're somehow being manipulated. So they don't want you to control them, but they go out of their way to control you. How can I put this? Unwittingly, unknowingly. Sometimes maybe they will injure you through their criticism, by things that they will say to you, by highlighting if you made a mistake. Gentleman that I was asked to see, I think I mentioned this to you last time we talked. The physician begged me to see this gentleman, and when I went to greet him at the hospital, I went to greet him early in the morning. I got there, and he said to me, the first thing he said to me, I said, "Good morning, I'm Dr. Micah Sadigh, how are you?" And the first thing he said to me was, he looked at his watch, he said, "You're 15 seconds late, not 15 minutes. And I laughed. What? I said, no, the guy is serious, absolutely serious. So that's the world. So don't take those things personally. So I'm going to get to this. Don't take those types of injuries personally. It hurts at times. So they don't want to make a mistake. So when you make a mistake, they project that onto you. Instead of saying, "I'm not perfect," they're trying to find a way to say, "You're not." They do punish themselves, by the way. Please make a note. They punish themselves through certain rituals they create for themselves. That if they do something bad and something wrong, they can't eat certain things, or they have to sit in an uncomfortable position, or they can't wear certain things. They have to wear those tight shoes. Somehow they have to undo the bad behavior. This suggests a very punitive and damaging superego. Wilhelm Reich, who wrote extensively about character armor, these shields we create around ourselves. He referred to them as living machines, and that's the way they appear. They seem something robotic about them. They can throw words at you, by the way. It's called verbal magic. They may throw words at you that you may not be familiar with. Sometimes they actually use words that they may not even make sense, but that's the way of gaining control of it, confusing you, etc. And I will be very sensitive to that, especially if you're seeing someone who's from a certain profession that they want to make sure that they're not just the boss in their business, but they're a boss here sitting with you. And they throw words at you just to confuse you or to say, "I know more than you do." It's verbal magic. Ultimately, they don't want you to know them, because if you get close and know me, you'll discover that I make a lot of mistakes, and I'm not that good, and I'm very anxious that you're going to see my vulnerabilities and my mistakes. Bob is a 31-year-old, so let's apply everything we program analyst, perfect. He has to work with computers, etc. Poor sleep, please note, very common in these disorders. He makes it very clear to say to you that he disagrees with the other doctors' diagnoses, and sometimes they throw this little zinger at you, like, I had to fire a bunch of doctors because they didn't know what they were doing. Again, don't get close to me. That's really good. Don't. I'm just laughing because it's happening so often these days. They go and surf the internet, and they don't read an entire article necessarily. Sometimes they read like the abstract or something, and they will ask you questions like, "Did you read so and so's studies in which they had an appliance with the clay instead of rubber?" I'm just making this up. So some strange looking things. And don't let that throw you off. It's basically saying, "I am knowledgeable." I would say be self-confident. Be as confident as possible. Just, I know my stuff. I've done this. No, I don't know about clay appliances. I don't know that. That's possible. They're interesting, etc. Your self-confidence is what they will hold on to. This gentleman, this patient, when it's a number of years ago, said, so you're familiar with this area? I said, yes, I published in it. Well, let me see one of those publications. I got up and grabbed the journal. Took, that's okay. That's okay. So, yeah, I know what I'm talking about. So, if you're late, you just explain. You know, I spend time with you. I spend time with other patients. Sometimes I may be late. You all matter to me, and I have to spend time with others. And if our session goes a bit longer, that's fine. You all matter to me. So please don't let them put you down. Basically, they're not aware of it. By the way, it's not like they're trying to harm you. That's a personality tendency. Look at people in their lives. Most beings in their lives are not animals. They're machines that you can turn off and manipulate in one. Meet with them, use their own language, by the way. Don't talk about feelings, talk about, they love structure, so give them structure. Don't say wear it at night. You say wear it right before you go to bed. I want you to do the following things: brush your appliance or whatever you do. Give them that kind of structure. They love it. They absolutely love it. When you give them structure, their anxiety goes down. Give them well-defined. This is perfect. So I had this one patient with this disorder that I had given him very specific instruction. Whenever you see anything red, you have to take a deep breath in and breathe out. And you read anything? Yes, read anything. Red light, just take a deep breath. So I gave him these little dots that he had all over it. He followed it to a T. So it's just perfect. They're excellent students if you give them that kind of instruction. Watch out when they become clinically depressed. They become very self-deprecating. Then you will see their facade falls and they go after themselves. Again, make your sessions predictable. You may start a session by saying, in today's session, we're going to do the following impressions. I'm going to look at this. I'm going to look at this data. We're going to go over this and that. And you will see actually their body actually relaxes when you give them that kind of structure. So also be careful because they can drain you. So create structure. Don't go out of your way. It's nice to say, how do you feel? How does this feel? To them, it makes more sense when you say, what do you think of this? What do you think of this fit? What do you think of this? Is it okay? And if they start using, it feels right, I think it's okay. They start loosening up, moving toward feelings, you have made an incredible achievement. So what are personality disorders? They are attempts at coping with the uncertainties of reality. I didn't say life, I said reality. Reality is with what we construct. So to these people, my reality is full of anxieties and full of criticism and full of being attacked, etc., etc. What is psychosis when this reality, my reality, begins to fall apart and break down? So why would you need coping? Because you have to survive this reality. With personality disorders, these coping mechanisms are maladaptive. Yes, it reduces my anxiety by creating all these tight structures, but I'm pushing people away. My doctors don't want to touch me, to walk in. People don't want to date me, don't want to hang out with me. They with someone, they're living upstairs, I'm downstairs, you just interact a little bit, etc. And you sometimes marry angels that can cope with these tendencies. So please remember, these are attempts at gaining control over the uncertainties of reality. And my message doesn't apply as much to you as to others. Would be, before you take away their controlling mechanism, I would give them some new, more adaptive mechanisms. So you don't want to create a vacuum. So pain is what helps me control my anxiety. Doctors, please remember this. Pain is what gives me control over my life. It helps me come up with an excuse not to be around people. And you, the magical doctor who takes away my pain, the structure that was controlling my environment, then I'm going to fall apart. My anxiety is going to go out of it. So your intentions were so good, so brave, and so brilliant, but now I'm exposed. That's why sometimes you have to sit back and say, I did everything they taught me. I took all these CE courses, CME courses, and why did I make a mistake? Why can't I fix this one? Because you're dealing with human beings who are unbelievably complex. And sometimes they don't want you to heal. So this is my email down there if you'd like to write to me. And I am done. Thank you so much for that extra 5 minutes for me to capture this last disorder. So you don't have to ask me to come back in 2 weeks to do this one.